So why did you go into pediatrics?
Oh, great question. I have just always loved children a lot. I am the oldest cousin and oldest sibling, and from a young age was like, we'd have family parties and I'd watch all the younger children for like a quarter while our parents all hung out downstairs. But I just think kids are so fun. Basically at every age, they are just, I like them when they're adorable babies that you get to hold. I like them when they are sassy toddlers, and I also like them when they're sassy teenagers. And they're just so fun and see the world in such a cool way. And I just feel like medicine's hard, and why wouldn't you want to pick the one where you get to hang out with kids that are fun all the time?
Yeah, of course. Do you feel like you're good with kids when it comes to interacting with them and handling them?
Oh yeah. From just having a lot of cousins, and yeah, whenever I'm like at any gatherings and there's kids, I always go hang out with them. And one of my friends' birthday parties recently, they called me the baby whisperer, and it was like me playing like Go Fish with like all the kids
Aw.
that were 4 and under.
Yeah.
Yeah, I feel like they like me too. They tend to come to me, and then I'll just hang out with them all the time.
Are you better at having like friendly interactions and playing with kids, or are you better at actually like getting them to do stuff and taking care of their needs? And both, yeah.
I have a lot of maternal instincts as the oldest sibling, and then
That's cool.
like I was saying with the Enneagram, the like number 2, the helper, I'm just very much a what can I do for you always kind of person.
Yeah.
So yeah, that, and also just like having a fun time with them. It's fun to let your inner kid out.
It also helps that you have extrovert thinking TE as the lead dominant function as an ENTJ, because that's basically the cognitive mindset that makes you attuned to what people need around you. What are some ways you can productively do stuff for other people, or get other people to do productive stuff too? Yeah. What do you think is most challenging about pediatrics?
Definitely just that kids sometimes they have trouble knowing what's going on and being able to express themselves, especially the younger ones. When they come in and they're sick, they're just crying because they hurt and they feel bad, and you have to rely a lot more on what you're seeing on the kid and what the parents are telling you to be able to figure out what's going on with them, because they can't verbalize it. So that by far is I think the hardest part of it is when they can't communicate with you.
Do you feel confident about how well you can communicate with both the child and the parent to kind of resolve those sorts of issues?
So far, I feel like I don't want to knock on wood. I haven't had much issue with that. I feel like I'm a strong communicator, and so in my experiences so far, I've been able to communicate with the parent well. And when it's a baby, they're obviously not really understanding what I'm saying to them. But when they're older, I have seemed to not struggle so far with communicating with them. And it's just a lot of what they teach you, asking open-ended questions, and like when you're done, just being like, does that make sense? Like if there's anything that doesn't, like please let me know, giving them time to ask questions to make sure that they really know what's going on.
Yeah. So that actually hit on a lot of good points for the next question I was going to ask, which is basically, how does TE extrovert thinking, the awareness of external logical order, help you become a pediatrician? Is there anything else you want to add to that?
I basically just touch on that whole thing. Yeah, it's helpful to just be able to be aware of your surroundings and being able to be like, this is what I need to do easily. So yeah, I guess that I haven't really ever thought of that in the reference of pediatrics, but yeah, it probably does help me.
What are some ways that NI, introvert intuition, the broad and more plethoric perception of your internal world, like how do you think that helps you become a better pediatrician? Like having an awareness of your internal world and plans for the future, being able to infer, see between the lines, hidden meanings and stuff. How do you think that helps you as a pediatrician?
Putting it in a frame of pediatrics, probably just, I know it's more like internal intuition, but I think it's helpful. And if like I'm able to know how I would be feeling in that situation, just kind of being able to like put myself in their shoes a little. Well, I guess it would be putting them in my shoes, but be like, if I was in this situation, this is how I would be feeling, and just kind of using that to being able to be like, this is totally normal if you are feeling these things, and that way, and just going from there and being like, this is what we can do.
Mhm.
It's probably the best way that it helps me.
Yeah, makes sense. Do you think there's a lot of planning that you need to do as a pediatrician and a lot of seeing future implications of stuff?
Oh yeah, that's a huge part of pediatrics,
Obviously, since
especially
these are kids, and of course, future implications
right,
are very
exactly,
important to be aware of.
exactly, especially as a general pediatrician for sure. When you have
Yeah.
kids coming in for their well child visits, you got to be, there's a whole checklist of things of like, are you up to date on your vaccinations? Like, are you, when they're younger, drinking enough milk? When they're older, are you not on a screen 24/7? Because that messes with you mentally and physically and all these things. And just being like, if you see a kid that, especially with COVID, well, childhood obesity has already always been an issue, but more
Mhm.
recently, it's definitely gotten worse, and just because people were staying home for years,
Yeah.
and just kind of being like this, like down the road, it's important for you to be able to move your body and things like that, and just like telling them steps of things that they can do. So yeah, huge future planning is huge in
Yeah.
pediatrics.
Would you say there's a more fairly balanced, uh, being attuned to, a bunch of things in the present and stuff being thrown at you in the present versus having, like addressing kids based on what are the long-term impacts? Do you think there's a fairly balanced, it's fairly balanced, or do you think you have to do one more than the other? Like, if that question
It
makes sense.
depends on what they're coming in for. If it's a well child, well, if it's a sick visit, really, they're obviously in there for a specific problem that's happening in the present. So that's more what your focus is on. Like if they come in with an ear infection, you're like, okay, this is what's happening. This is what we need to treat and focus on more so. Versus when they don't come in with specific things, you can do more future planning and being like, okay, well, like he's about to be this old, these are the things that children that age should be doing, these are things to be looking out for, and make sure they're like reaching milestones and stuff like that.
Mm-hmm.
So good
How
balance.
yeah, how confident are you when it comes to thinking? How confident are you when it comes to, I guess, guessing and using your intuition when there's not enough like information about what's wrong with the child or what's going on, or how confident
Oh,
you are in like intuition?
I would say when it comes specifically to being a doctor, I haven't been that long, so it's like I um I wouldn't say I'm overconfident. I try to be very like, this is what I'm feeling, but obviously still talking to like attendings at things, that being like, is what I'm feeling right? And generally what it comes down to a lot with kids is you just look at them and you can tell if they're really that sick or if they're okay, like if they're, let's say it's a toddler and they have a cough and a runny nose, but they're still like running around the room and like being crazy and things, like, yeah, they have a cold, but like they're okay, like they're
Yeah.
playing and they're fine. Versus the kids that are like crawled up like in the fetal position and like can't move, or just like
Mhm.
look so out of it because they're just so sick. And so I feel like that is a little bit easier with children than adults. I feel like as adults, we learn a lot more to mask our feelings and things, and kids don't do that as much. So it's it's a lot easier to just
Unless
kind
they're
of see
shy,
it on their face.
unless they're shy children.
Yeah, yeah. A lot of times it's just how they're acting in the room. It's
Yeah.
easier to tell like where they're at.
How often would you say you get moments where you're hit with like spontaneous, like sporadic things that you weren't prepared for, random events that kind of throw off like your expectations?
Not
Because that's basically what
often.
that would tie into a lot, that would require a lot of like extrovert sensing, SE, having
Right. Yeah.
external perception of reality,
Yeah.
awareness on what you can do in the moment,
Yeah.
randomly without pre-planning. And
Right.
um,
I will say that personally, I haven't experienced a lot of that because I have not been in the emergency room yet. I feel like that I would have more of that experience there. But like when it comes to like clinic and things, it's very rarely was it like strange things that come in. Like it might have been like once I saw like a weird rash and I was like, I have no idea what this is. But outside of that, not often. It's been pretty run-of-the-mill stuff so far.
I guess in general, that's kind of the norm for most primary care positions. Like you tend to know what to expect, and when you don't, you just get a specialist to address the complicated stuff. But
exactly,
it's not like
that's nice about like the clinic that I'm at. We have like the resident run clinic, but then like right next door is all the specialists. So whenever you do have questions, you just walk down the hall to their office and be like, I don't know what's happening, and then they help you out.
Introvert feeling. Having an awareness of your inner emotional world and having emotional harmony. How do you think that helps you become a better pediatrician?
I think it's helpful, really just with any job, just knowing what you're feeling. Like if you come in and you know that you've already had a bad morning and being aware of that, so then you're able to not be mean to everyone around you, just being like, it's none of their fault, like I just, woke up on the wrong side of the bed or something, and just being aware of it, because I have found myself sometimes be short with people and then I'm like, oh, that's not them, that's that's me, and being able to realize that and then fix it so I don't stay in a snappy mood.
So you're fairly good at shifting your emotional world when you need to, without having to get stuck in a certain like mood.
That's good. And I think as Christians, that also is like hopefully extra what we do, just because it's the whole like Jesus loves us, so we're supposed to love everyone and be kind to everyone and not judge people and all these things, and the golden rule, treat others how you want to be treated, and all those things.
And that can come from, it doesn't matter what your personality is. It can come from an extrovert or introvert perspective. Extrovert feeling would just be more like, okay, this is just basically what I need to do. I need to be nice to people, whatever, regardless of how I'm feeling. And then after that, eventually I'll feel better, authentically feel better, and actually, feel what I'm showing others that I'm feeling. Whereas with FI, it starts more, okay, like, let me just shift my emotional world first, and then I can, be able to treat others the way I'm supposed to. You can go from either direction.
Right.
Same outcome, but yeah.